Welcome to the Health Stuff You Need to Know podcast. Information you need to thrive in our toxic modern world. I'm your host, Scott W. Kirkland. I hope you're ready because it is go time with the Wellness Web. Yeah.
My guest today is Monica Marusceac. She is a board-certified hypnotist. Monica is outgoing, experimental, and an out-of-the-box thinker who often ignores the box altogether and is likely to provide you with unorthodox perspectives and ideas. Monica intuitively understands the ideas and feelings of others and inspires her clients to become involved advocates in their own change process. She will use hypnosis and NLP to strategically persuade you and inspire you to embrace opportunities for change and explore changing the game in addition to changing your thinking. Never boring, always experimenting, Monica will captivate your imagination and guide you to discover new ways to solve old problems and maybe even change the rules of your life entirely. Monica is a military veteran with over a decade as an active-duty Marine AV-8B Harrier jet pilot. She has served overseas and has had the distinct pleasure of working in the Pentagon for her last duty assignment. In fact, she still serves in the United States Marine Corps Reserve, in addition to founding and running the change space called Nova Hypnosis and Wellness. Monica started this hypnosis practice because she believes everything starts with the mind. It doesn't matter what it is. For example, the efficacy of medications can be improved by focusing the mind on amplifying the medicine's beneficial effects and minimizing its side effects. Originally on track to go to medical school after leaving active duty, Monica decided to remain a hypnotist after seeing how many people were able to overcome their mental, emotional, and even some physical problems with the assistance of guided hypnosis. Monica is a graduate of Cornell University and enjoys snowboarding, scuba diving, and spending time with her husband, son, and 3 Siberian Huskies. So welcome to the show, Monica. It's great to have you on.
Thank you so much, Scott. I'm excited to be here.
Great. So one of the first questions I like to ask my guest is that they've had a health challenge that they've overcome and how they did it.
Oh, yes. So it's funny you should ask that question because where I am today, I would not be if I hadn't have had this happen to me. And it relates to my knees. I have severe osteoarthritis in both knees. And I didn't know I had this condition until 2009. So in 2009, I was 30. And I was on deployment, on my last deployment, and we were pirate hunting. We were searching for pirates in the Gulf of Aden. In fact, my ship was the one involved in the Captain Phillips rescue. I don't know if you or your viewers remember that, but they made a movie out of it. And so we did a lot of flying, but we sometimes didn't fly at all. And on those days, I would spend a lot of time running and training for marathons. I believed that pain is weakness leaving the body, just like all Marines do. And I attributed my knee pain to, sore muscles, not to actual physical damage that I was causing myself. And then when I got back from deployment, my knee started to give out. And so all that running that I'd been doing caught up with me. And I went to the doctor thinking that it would be no big deal. It would just be, they would give me 2 Motrin and tell me to call them in the morning, that sort of thing. And what they actually, with just the x-ray, what they discovered was that I was a 30-year-old woman with 70-year-old knees.
Oh, wow.
And yeah, I had no cartilage left on the lateral surface of my patella. And I was down to half thickness on the medial or the inner surface of my patella. So where my patella impacted my femur, it was basically all the cartilage in that joint space was being destroyed by my running habit. And I, like all Marines, was crushed because we base our leadership upon excellent physical fitness and the ability to outrun one another and to outjump one another and that sort of thing. Even the pilots care about that. So the subsequent tests that I had supported the initial findings, and I had a major knee surgery within 3 months of that initial x-ray, where it's called a Fulkerson osteotomy. If anyone wants to Google it and look at the YouTube videos, it's pretty gross. They fillet your leg open and realign your patella so that it no longer crushes the cartilage in the joint. But the surgery actually didn't do me much good. I still have pain in my knee when under certain conditions, and at the end of the recovery period, really the only thing I could do for myself was to change my lifestyle. And it started with changing my eating habits, because I was always a little bit overweight, and that excess weight, because of too much drinking, too much eating, too many sweets, was leading to unnecessary pressure and pain and weight bearing joint. So I stopped running altogether, which was very difficult for me to give up. And I completely had to focus on my diet, because walking is just not going to take weight off. Weightlifting will strengthen the body and add muscle, but it's at the end of the day diet that's going to do the trick. And so I cleaned up my diet. I started eating what I'm sure a lot of people can agree is a healthy diet, with lean protein, vegetables, fruits, and small, very, very small servings of whole grains. And without going into too much detail on the diet, I lost 35 pounds after my knee surgery and have kept it off since 2011.
Fantastic.
Yeah. And now the knee pain is very minimal. Only when I, choose to run stairs or do something that I know actually isn't good for me. Only then does it pop up. Otherwise, I'm pain-free.
Oh, wow. So that the change in diet really made a big difference in your life.
Hugely. Yeah. And you wouldn't think so, that diet alone could keep weight off that way. But I exercise minimally. I really just focus on what I eat. And when I eat, I would say is equally important. And the weight stays at bay. I fluctuate maybe up or down 3 pounds.
Oh, fantastic. What really interests me about hypnosis is that a lot of people, their lifestyle choices have caused disease states. And they know that they should eat more vegetables. They know that they should change their exercise plan. But the mind kind of gets in the way. We have these patterns and habits. So I'm very curious about your work and how you use hypnosis to help your clients.
Yeah, well, I absolutely love the work that I do. I say that unequivocally. I think it's the best job in the world, because everything really does start with the mind. And so you referenced habits just now, which is absolutely true. And if you can think of a pyramid, well, kind of like the food pyramid, but it's called the logical levels. And the logical levels is a hierarchy of conditions that affect our success. And so with hypnosis, and by the way, just for any listeners who think hypnosis is something unusual or rare or something to be feared, it's really not. It's something we do all the time on our own, as whenever we're daydreaming or recreating a conversation in our head. All of those are states of hypnosis. So when I guide people into that state of focused concentration, I help them to address primarily their belief system and their identity. So they will come to me with, let's say, a health-related goal like losing weight or quitting smoking. And I've always found that the solution is never at the level of the problem. It's always at the level of beliefs and identity. And while I will, promise people what they want, which is to quit smoking, and I always deliver what I promise, I get them there by giving them what they need. And what they need is a new set of beliefs to restructure how they see themselves in their environment and help them to move through the challenge that they've experienced up until now.
Oh, wow. Interesting. So how does it work? Like what's really going on in the base level?
Yeah. So at its fundamental core, hypnosis is a state of mind where the brain is in an alpha brainwave state or a theta brainwave state. So alpha, the way I describe it, is that state of mind when you're about to fall asleep. I call it twilight sleep. You're laying down, you're half awake, half asleep. You feel like you're there, but drifting off. And so using specific suggestions, I can guide someone from a conscious state into this alpha brainwave state, which is, you can also think of it like meditation. It's that same feeling for those meditators out there. And I can either guide them even deeper into theta, which is another different brainwave state, similar to, you could say, a light state of sleep. But these individuals who are working with me are interested in listening to the suggestions that I'm giving them. And those suggestions can be either suggestions to guide them into hypnosis. That's the initial, category of suggestions that I'll give. And then once they're in hypnosis, I will give them suggestions that support the change process. And the way we perform the change process is, there wouldn't be enough time on this call for me to go into the details, but it includes positive suggestion, indirect suggestion, regression therapy, parts therapy, you name it.
Okay. I'm curious. I did a little background research for the interview, and I was surprised that hypnosis has been proven like a long time ago for its efficacy. I know some people think it's maybe not. They think of it as, like a nightclub entertainment act or something like that. Right. But it is not, because there's been a lot of clinical studies. And what amazes me is that people actually use it for, instead of getting anesthesia, for surgeries like dental surgery or even birthing. Like, I think that's pretty incredible, because that's a serious amount of pain.
Yeah. Well, if I can have 1 minute,
Sure.
I was just invited to join a medical practice in my area here in Washington, D.C. And the doctor who invited me, I asked her, why are you interested in adding this to your practice? And she said, because when I was in the military, so she was a former Army physician. When I was in the military, the head of our psychiatric department performed hypnosis for a patient of ours who was allergic to all forms of anesthesia. And I personally witnessed with my own eyes, she says. Her name is Dr. Mary Babcock. You can look her up. She's in Great Falls, Virginia. And I watched this person undergo abdominal surgery with no chemical anesthesia.
Wow.
They had a saline, IV, but that was it. And the entire procedure was done under hypnoanesthesia. And I said, oh, well, that's awesome. I joined the next day during the practice.
That is pretty impressive. Like, that's actual, like cutting open the abdomen, going in there. Oh my God. That's amazing. That's even more than I thought it was.
And this can be done with acupuncture too. I want to mention that. So
really?
People have used acupuncture for anesthesia as well. So there's another option.
Wow. That's impressive. So I'm curious about, you use NLP as well. So I'm wondering if you can explain what that is and how because that ties in really well with hypnotherapy, I understand.
Yes.
It's really more effective than just regular hypnotherapy.
Exactly. Yeah. So NLP stands for Neuro Linguistic Programming. And what it is a collection of language patterns and communication techniques that two individuals collaborating, they collected all of them and organized them and amplified and gave them names and set them up as this structure of this way of communicating known as NLP, Neuro-Linguistic Programming. Some people call it waking hypnosis. And what it is it gets around the conscious mind by using specific ways of conversation. Obviously, when I train people for NLP, I only train them on how to do this ethically, right? But any person that you've met who is persuasive, any person who you've met that you would describe as charismatic, that has great rapport with people, that person is employing NLP techniques, whether consciously or unconsciously. And in my practice, I use NLP either before or once the person is in hypnosis to go around the critical factor. So the critical factor of the mind is the rational, judgmental, analytical part of the brain. And the way that I word things, the way that I phrase questions or suggestions, all serve to bypass that critical factor to help that person get from where they are to where they want to be. Because oftentimes we have limiting beliefs bunched up there in that critical factor space, so to speak. And so I go around it using NLP.
Okay, so you can remove people's limiting beliefs. Does that make sense?
Yes, it does. That's exactly right. We use a variety of techniques that help people to chunk up or chunk down and reframe, reorient their programming, meta programs. We all operate under programming from our childhood, programming from the media, programming from whatever occupation that we have been trained in, like the military for me, for example. And so all of that programming on a conscious or unconscious level affects the story that we tell ourselves and the limiting beliefs that go along with that story. So by helping people to reprogram their own, their mind through changing their story and eliminating or destroying limiting beliefs, they can then make the change permanently versus me just giving them positive suggestions alone.
Okay. How long does it last? Is it pretty enduring?
Yeah, it can be. It absolutely can be. I've worked with people who have used hypnosis to quit smoking. They used it once and they never smoked another cigarette. I'd say that that's always a possibility to go to a therapeutic hypnotist or hypnotherapist one time and be forever changed, but I will say that it's probably unlikely. What I found is more common is people come in for a certain issue as long as they're open to exploring where that issue came from and then rewriting that story through the hypnosis and NLP process. Then we've eliminated any secondary gains that they may have had from doing the thing that they were doing, the smoking or the overeating or even with pain. Some people experience chronic pain for years and they're not willing to let go of it because they get a secondary benefit from remaining in pain. I'll tell you that for me, towards the end of my career, I was unhappy in my position. It was a variety of reasons that I was unhappy in the military at that time. And a little part of me wonders if my knee pain, which ultimately drove me to go into the reserves and separate from the active component, I wonder if my knee pain contributed to that decision. And the secondary gain I got from having the knee pain was the fact that it would give me permission to make this change. And so I'm sure everybody listening can think of something in their life that they would like to change, yet at the same time, it's giving them some kind of benefit. And that's the aspect that I need to work with when trying to help a client, is helping them identify how they're actually benefiting from the very thing they're trying to eliminate, and then helping them to satisfy that need in another way.
Okay, interesting. How many sessions does it normally take to get the desired results? Because a one-shot deal probably isn't that realistic, but it can happen.
Yeah, exactly. So again, it depends. And, I've never promised anyone a complete resolution after a specific number of sessions because it would, I really don't know. Just like with, knee surgery, the doctor can say, I'm going to do the very best job I can. But at the end of the day, I can't promise you that you'll live without pain. Mm-hmm. And so in the same way, that's what I tell my clients. But having said that, I would say the average number of sessions that my clients work with me is between 4 and 8.
Okay. Yeah.
So between 4 and 8, even 3 at times, with a more straightforward issue like a phobia, a fear or phobia, we can adequately resolve the issue to the point where that person feels successful.
Okay. So I'm just curious what the cost is, just for my audience, just if they're considering using hypnotherapy to change something in their life. What's the kind of ballpark figure?
Sure. So I'll give you the ballpark figure for the industry, and then I can disclose my kind of package prices, so to speak. So I would say typically the fees are going to be between $150 to $250 per session, and different providers are going to do it differently. Some of them will agree to do it session by session, and so it's up to the person coming to understand that it's not a one-shot deal and commit to themselves as a client that they're going to come for multiple sessions. For myself and others who work in this under the same paradigm, we create custom programs for every client that walks in the door. And so my cheapest program that I've ever offered anyone was $550. And then the most expensive one I've ever offered anyone was $34.95, so about $3,500. And the difference between those two was the number of sessions, whether the sessions were in person or over Skype, whether we did any extra services, like whether we recorded hypnosis recordings for the person to listen at home and reinforce the message. We may also have provided them with homework so that they submitted their homework and we reviewed it before the appointment. So depending on the combination of services, the whole experience could have been more expensive or less expensive.
Wow, that seems pretty reasonable considering the value that you would get. Because I think if someone, say a smoker, who spends, who knows how much per year smoking, depending, and
right.
then if they can eliminate that habit and just to save the money that way, let alone the health benefits that they're going to get, or say a diabetic who is having trouble kicking their sugar habit,
right,
and to be able to get their health back, which is, it really is priceless. So that seems pretty reasonable. I'm curious about, you mentioned that you can do sessions over Skype?
Mm-hmm.
Wow.
Yeah, I do. So there are certain things I can't do. Like, there's a technique called the arm drop where I would gently lift someone's hand or forearm by the wrist just to see if they were relaxed or if they still had tension in their arm. Obviously, that's a technique I can't do over Skype. Another technique is called, it's a certain type of fractionation, and it involves me having my hand in front of the client's eyes. So when they open and close their eyes, my hand is right there. I can't do it the same way, but I can still help someone go deeper into hypnosis using fractionation, but it's executed a little bit differently. But other than that, there's no limitation really. We need a camera, we need a good internet connection, and we need both parties to have their computer set up in such a way that it's not going to shut off after, 15 minutes of inactivity or something like that.
Wow,
and then we're go.
That is incredible. You could pretty much help anyone in the world that has internet access. That blows my mind. It's awesome. Yeah, it's an amazing time we live in.
It is.
I read, I know that you're a new mom, so congratulations. So you have another baby. How old's your baby?
Yeah. So the new baby he'll be 12 weeks.
Oh, wow.
In a few days. So he's just under 3 months old, and my older son is 5.
Oh, wow. That's congratulations. I have a
Thank you.
11-month-old baby who's my pride and joy. And yeah, she is absolutely amazing.
Congratulations.
I'm curious I was reading about NLP and its use in parenting, and I'm wondering, I'm assuming that you must use NLP in parenting?
I do.
Can you?
Yes.
Because there's lots of parents out there. I wonder if you can tell people about the benefits of that, or maybe some techniques as well.
Oh, definitely. So without realizing it, parents plant multiple negative suggestions into their child's mind. So we call children impressionable for a reason. They generally, when they don't want something, right, when they're just kind of relaxed and running around and being kids, they're open to suggestion, most especially by the people that they view as authority figures, of which, of course, the parents are the foremost authority figures in their lives. And how we phrase things can either create self-doubt or create, self-confidence. And it's all in the delivery. For example, this is not exactly what I'm talking about, but this is a great example that how words mean things. So a lot of parents will say to their kids, be careful, don't drop that, or don't run, or, don't do something. We say that all the time. Well, what does the mind have to do? The mind has to hear the command, run, or drop that, or whatever it is, and then has to apply the word not, has to negate that command. So the command is really to run, to drop this, to say this, whatever it is, and then we've got to negate it. And so kids, their cognitive function isn't as advanced as adults, and so they actually will first drop something and then realize, oh my God, I wasn't supposed to drop it. Oops. So learning how to phrase things in a positive way is just a really easy way to start practicing, mindful communication with our children. So instead of saying, don't drop this, another way to phrase it would be to say, hold on to that tightly, or walk, slow down, whatever the case may be. The same goes for adults as well. My mom has a tendency to say this all the time. She'll say, don't forget to lock the door. And I am always forgetting to lock the door, usually when she says that. If she were to say, remember to lock the door, Monica, then it would stick out in my mind that that's what I need to do. So it works for adults as well.
Okay. Is it kind of like when you say, do not think of the color yellow?
Correct.
And then, but your mind has no choice. It has to negate.
Right.
To
That's right.
Yeah.
Don't think about a pink elephant. And, I'm already thinking about a pink elephant.
Me too, Bev. There it is.
Yeah.
Can you help someone with a serious addiction, like someone who's addicted to alcohol or heroin or something along those lines? Is that?
Yeah, it is. It's really best. Hypnosis is best used as part of the therapeutic process. So I've seen it work successfully when the addict was also working with a psychotherapist and was perhaps on medication and had a support group. And then the hypnosis was a technique that reinforced all the other work that was being done for that person.
Okay. I'm curious, if someone wanted to see a hypnotherapist, I'm curious because there's different certification bodies and you're a board certified hypnotherapist. I'm wondering, what does somebody need to know when they make that decision?
Yeah. So a few things, and cut me off at any point if I go too long. But for example, I'm board certified through the National Guild of Hypnotists, and that's the largest certifying body in the world. We've got more certified and board certified hypnotists than any other organization. There are several others like the National Association of Transpersonal Hypnotists, Hypnotherapists, the IAC, which is the International Association of Counselors and Therapists. I'm trying to think of other bodies, but the bottom line is it's not the industry is there aren't enough of us basically for the regulation to be very stringent. So there are a lot of doctors, there are a lot of psychotherapists, a lot of counselors, a lot of social workers. And so because the numbers are so great, it makes sense for countries or states to institute or set up regulating bodies like licensing boards and things like that. So in theory, there's a minimum standard that the providers have to go through in order to be technically licensed. At least in the US, no state has a licensing body for hypnotherapists. So, however, I do think hypnotherapists serve a very important role, and I'll explain why in a moment. But for example, there are more social workers in Chicago than there are hypnotists in the National Guild altogether.
Okay.
In the world.
In the world.
Right?
Wow.
Yeah. So there are some psychotherapists, meaning counselors, social workers, and psychologists who practice hypnosis. They use hypnosis as a tool. So there you might find someone that is, licensed and practices hypnosis. But what I found is that the primary interest or training of that person is to do talk therapy or cognitive behavioral therapy or whatever it is. And then they're only using hypnosis on occasion. And so they're actually not that good at it. Now, if you get a certified professional hypnotist like myself, who has gone through and gotten a lot of training in addition to their initial certification training, and you see that the person has experience and they have a lot of positive reviews, whether on their website or on another source like Google or Yelp, then you can feel good that that person has talent and has training and has proficiency at using hypnosis as a tool. So the psychotherapists who are licensed, they have the background of therapeutic background, but their approach is completely different, where they're primarily focused on the problem, analyzing the problem and understanding it. Whereas hypnotists, hypnotherapists, we're focused on the desired outcome. We're actually not that focused on the problem. We're focused on, changing, helping the person change, and doing whatever it is we can do to get them there. So it's more like coaching. It has that more of that paradigm than the therapist paradigm. But it is important to confirm that the person you're working with is someone you trust, someone in whose office you feel comfortable. A lot of people sometimes practice out of their basement, which I don't personally agree with. I think it's important to have your own therapeutic office space for providing hypnotherapy. And then you'll feel comfortable and the work will flow smoothly, because without trust, hypnotherapy doesn't really work.
Yeah, we definitely need to trust your hypnotherapist.
Yes.
Yes, indeed. So I'm curious about, there's some people who practice like a self-hypnosis. Do you find there's value in that, or is it very effective? Or
yeah, I would describe self-hypnosis as a very structured form of meditation with a specific purpose in mind. So people who meditate, I think, or a lot of people who try to meditate, I'll use that word, try.
Yes, it's easier said than done.
Yeah. They struggle with meditation because the instructions are somewhat ambiguous. Go ahead and focus on your breath. Okay, what does that really mean? Or just allow those thoughts to, drift away. Okay, what does that mean? So when I teach people self-hypnosis, I give them a series of very specific steps, like a process, a procedure that they follow that leverages human physiology, that leverages breath, that leverages sound, that all, when done all at once, allows the person to guide themselves into hypnosis very rapidly. So they don't really have time to second guess themselves or allow their thoughts to drift or whatever the case may be. And it's a series of 6 steps that are done all at once. And the person can guide themselves into a light to medium state of hypnosis in a minute or less. And they can keep themselves there through a series of their own suggestions, which you can kind of liken to affirmations. So I teach people how to give themselves their own positive suggestions. And the end result usually for people who want to do self-hypnosis is physical relaxation, lower heart rate, lower blood pressure, and usually they'll receive an insight or a new perspective that is helping them get closer to their goal. So they have a goal in mind before they enter into self-hypnosis. And when their mind is relaxed and free from other distractions, they're able to make more headway towards that goal.
I've heard that some people have a higher propensity to go into hypnosis than others. Would you agree with that?
Uh-huh.
So that's true?
Yeah, I would say that is true. But I've never met a person who wasn't hypnotizable.
Oh, really? So everyone can benefit from it.
Absolutely. Everybody can be hypnotized, just like everybody can fall asleep. Everybody can daydream. Everybody can become fascinated by a movie. So, I describe hypnosis. Some people confuse hypnosis and relaxation. And I'll describe to them, have you ever watched a movie that was scary, that was a thriller, and you were on the edge of your seat and your heart was pounding and your palms were sweating and you were just, you were there. You could sense you were with the character and you knew in the back of your mind that was a movie with actors, and a script and a plot and all that. But you had a physical reaction and you were glued to the screen. And everyone, of course, says yes. I say that was hypnosis. You were hypnotized by the movie. You were having a physiological reaction. You were sweating even though you were in the movie theater. Your palms were sweating. Your eyes were dilated. So you were hypnotized. So if you can do that, what would be different about sitting here with me and allowing me to be the director of the movie inside your mind? Because that's all I'm doing is I'm being the director for this movie, which will help you to break through this obstacle that you're experiencing in your life. But different techniques work for different people. So if someone says, I tried hypnosis, but it didn't work for me, or I tried hypnosis and I couldn't be hypnotized, typically that's because the hypnotist only had a limited array of techniques at their disposal. And a person who's analytical is going to go into hypnosis differently than a person who's very creative and free-spirited and relaxed just right from the start. So you can think of it more like there is no such thing as a resistant client. It's really only resistant hypnotists who refuse to flex and give their client what they need in order to go into hypnosis. And what each client needs can be different on any given day or different between clients or, different depending on the problem that they're coming in for. It's very interesting. There's absolutely no one who is not hypnotizable. Everyone is hypnotizable.
All right. Well, that is good to know. And anyone can be helped. That's fantastic. So we're coming up to the end of our time, and I'd like you to tell us where, if people are interested in working with you and like to find your work, where would they go?
Oh, well, thank you. So we have a website. The website is novahypnosisandwellness.com, and the and is spelled out A-N-D. Our physical location is in McLean, Virginia, which is right in the Washington, D.C. area. And as I mentioned, I do have clients who are outside the area because I do work over Skype. I also use a service called Zoom, Z-O-O-M, really great product. And then I'm also teaching classes in the local area as well as online. The classes that we teach are Neuro-Linguistic Programming certification courses. We also teach hypnosis certification courses. And then I have my personal little pet project, which is I call it my Mastery Boot Camp. And it is a workshop with a small group where I teach people specific NLP and hypnosis techniques designed to help people gain mastery over their mind and their emotions. So that whether they're going up to do some public speaking, or they're going in for an interview for a job, or they are a child who needs to take a test and they have test anxiety, through this boot camp, they're going to have the knowledge and the skills and the experience in mastering their emotions and putting themselves in the right state, the right mental and emotional state for success. And that's my little pet project that I have launched this spring.
Fantastic. Well, thank you so much for being on the show today.
Thank you so much, Scott. I really appreciate it and really enjoyed our conversation.
Me too. It's highly educational. I learned a lot today.
Awesome. Thank you.
All right. Bye for now.
Bye-bye.
We have reached the end of this episode. I hope you have found a piece of information you can use to improve your life or the life of your loved ones with. If you feel that I've helped you in some way, I ask that you help me in return. Liking, rating, reviewing, sharing, and or subscribing all help me rise in the search engine rankings so I can reach and help even more people. Subscribing being the most important one. Thanks in advance. As always, I will continue to bring you the hell stuff you need to know.